As a citizen and a resident of the city of Montreal, I feel compelled to begin with an apology. I'm not here to speak for the Canadian government. I can't. I can't speak for IAS because I'm not part of IAS. But I feel very ashamed as to what has happened in this meeting. 2 months ago, I wrote a piece in Forbes called Passport and Visa Privilege in Global Health. When I wrote that piece, I wasn't thinking at all about the AIDS conference. Every single thing I wrote in that piece has come to pass in this meeting. This meeting is a textbook case of what is wrong with global health and why decolonizing global health and HIV/AIDS response and all of that matters. So I'm deeply sorry, I'm ashamed. As a country, we could have and should have done much better. This is what I wrote in that piece in Forbes 2 months ago. I had written, global health was neither diverse nor global, even before the pandemic. But now there is a real risk that all global health events will start resembling Davos. Elite white people getting together in North American, European cities to discuss issues that mostly impact Black and brown people in low and middle income countries. There is a big risk that people in the global South will be left behind or left trying to join hybrid events via unreliable internet connections. This is exactly what has happened. And this is a metaphor for why exactly we are struggling with global health. Vinny said something about unconscious bias. When something happens once, I think it's fine to say it's a bug, it's an error, it's a mistake. But if there is the same pattern that happens decade after decade after decade, there is only one explanation, that it is intentional, it is deliberate, and it is designed to work as it is designed. Let me walk you through a memory lane for which this conference is not at all alien to. Years ago, when ARVs became available, who was at the bottom of the list for access? Black Africans. When Ebola was ravaging Africa, nobody did anything until white people got Ebola. Who was at the bottom of the list? Black Africans. When COVID happened, which continent has received the lowest access of COVID vaccination and was prevented from performing and making their own products? The African continent. Monkeypox, who is least likely to get vaccinated for monkeypox? Africans. When this happens decade after decade after decade, there is no explanation on the planet except white supremacy and racism. There is no other explanation anybody can come up with. This is not a bug. This is not a glitch. This is deliberate and intentional to work as it is working out. So if you want to decolonize HIV or global health, you've got to start by confronting this fundamental problem that every single aspect of global health is designed to benefit people in the global north. It was never intended to center on people who really matter. And that is why these things that happen are not accidental, they are intentional and they're deliberate. And you cannot change this unless you truly understand it. How many papers have now been published on decolonizing global health? Every one of them show the same thing again and again and again. Every aspect of global health is dominated by folks like me in the global north. Now, what needs to happen if you want to decolonize? Two things need to happen simultaneously. The global south must assert itself. They have to be in the driver's seat. They have to demand their fair share of whatever it is that they need. They have to be self-sustainant and self-reliant, which is exactly what the TRIPS waiver was about. They're saying enough of this charity bullshit. We want to make our own products and save ourselves. And we didn't back that. Canada did not back that. Canada failed miserably to back a request that more than 100 countries approved. What does that mean? We are fine with maintaining a charity model, a trickle-down charity model, but we are not keen to empower countries. They want to do what they want to do to save themselves, and we failed to back them in that quest. So self-sustenance and self-reliant and self-determination of black, brown, indigenous people and the global south is fundamental to decolonizing global health. Now, what does that mean for the rest of us? What does it mean for me, someone who's living here? My path to salvation, I see as allyship. I have to get out of the way when I need to, and I need to stand behind people who are at the front line. I need to be a good ally to them. That means white people have to be good allies to black, brown, and indigenous people. Men like me have to be allies to women. Cis hetero people have to be allies to LGBTQ. And the list goes on because it's intersectional. There is no end to intersectionality because there are always people who are oppressed. I'm brown. I'm immigrant in this country. I've been denied visas. That still doesn't mean I oppress somebody now, because I'm in a position of privilege that I need to acknowledge from where I am standing today. So white supremacy is not just about white people. It's a mindset. And anybody can have that mindset. All of us are capable of oppressing others. So let's do what we need to do. Those of us who are privileged, elite, based in the global north, high-income countries, are highly educated, let's be allies. That is the only path to collective liberation. That is the only path to safety in this world. Thank you so much.